Hello, I am Farhana Binti Jemat and I am from class T1. So today, I will explain about the interaction between warfarin and John's wort. Warfarin is a cardiovascular drug we use to treat a cardiovascular disease. Introduction about warfarin. Warfarin is an oral anticoagulant that works by inhibiting vitamin K-dependent clotting factors, and it helps to prevent and treat harmful blood clot. The usage of warfarin is it is used to prevent stroke, prevent clot in the lung, in the leg, reduce the risk of recurring clotting, and prevent valve thrombosis. Introduction about St. John's wort. St. John's wort, that has a scientific name that called Hypericum perforatum, is a flowering plant native to Europe that used for centuries in the traditional medicine. The usage of St. John's wort is it is used as herbal supplement that used to treat mild to moderate depression, anxiety, sleep problem or known as insomnia, and lastly, it is used in a wound healing. What is a drug-food interaction? Drug-food interaction is an action of the drug when certain food and medication are taken together. The understanding of the drug-food interaction is important to ensure that medicine is worked properly and safely. The common example is a dairy product can reduce the absorption of certain antibiotics like tetracycline. How food can influence drug pharmacokinetics? Pharmacokinetics can be defined as what body does to the drug. Food can significantly influence a drug pharmacokinetics, which is how the body absorbs, distributes, metabolize, and excrete a drug. How the food affect ADME? A for absorption, change in pH, gastric emptying, solubility, and binding. D for distribution, it increases the plasma protein level or decreases the plasma protein levels. M for metabolism, it influences the first pass metabolism. And E for excretion, the food rarely affects excretion directly, but it still gives an effect for a certain food-drug interaction. Mechanism of interaction for warfarin and St. John's wort. The interaction type. There are variety of interaction type. For example, enzyme induction, enzyme inhibition, pH alteration, and chelation. But interaction for warfarin and St. John's wort only involve enzyme induction. How enzyme induction works? Firstly, St. John's wort will induce CYP3A4, CYP2C9, CYP1A2, PGP enzyme at warfarin that cause the increase of metabolism of warfarin, decrease the warfarin plasma concentration, decrease the anticoagulant effect, decrease the international normalized ratio that cause risk of clotting will be increased. Pharmacokinetics of warfarin drug. It is well observed orally. It has a small volume of distribution in highly protein bound. It's metabolized by CYP enzyme, which known as CYP2C9, CYP1A2, and lastly CYP3A4. Inactive metabolites will excreted in urine and bile. How warfarin and St. John's wort affect the drug pharmacokinetics? The impact between warfarin and St. John's wort interaction cause the absorption decrease due to the increase of PGP enzyme, but distribution has no significant effect. For metabolism, it will increase the metabolism through CYP induction, cause the decrease in plasma concentration of warfarin and decrease of INR that possibly increase through the PGP mediated transport. Clinical consequences. The interaction of warfarin and St. John's wort has only one potential risk, which known as reduced effectiveness. Firstly, St. John's wort will induce cytochrome P450 enzyme that cause warfarin to metabolize faster. When enzyme working faster, warfarin is broken down and cleared from body more quickly, cause decrease of warfarin concentration in blood. The INR will decrease, cause blood clots faster than usual. It becomes less effective at preventing blood clot. This will increase the risk of deep vein thrombosis, pulmonary embolism, stroke. Case study of effect of St. John's wort and ginseng on the pharmacokinetic and pharmacodynamic of warfarin in healthy subjects. The method of study is by doing three-way crossover randomized study in 12 healthy male subjects. Each of them will receive a single 25 mg warfarin dose under three conditions: alone after 14 days of St. John's wort and after 7 days of ginseng. The conclusion of the case study shows that St. John's wort significantly induced the apparent of clearance of both S warfarin and R warfarin that caused the result in a significant reduction of pharmacological effect of red warfarin. What patients should avoid or modify in their diet during taking warfarin drug? They should avoid or limit certain beverage, for example, alcohol, cranberry juice, and green tea. Alcohol can increase bleeding risk or reduce warfarin metabolism. Cranberry juice may increase INR that can cause potential bleeding risk, but green tea contains vitamin K that can reduce INR. Patients should also be careful with supplement and herbal products such as ginseng, fish oil, St. John's wort vitamin K supplement. Ginseng can increase bleeding risk, but for fish oil, it may increase bleeding tendency. St. John's wort can reduce warfarin effectiveness. Vitamin K supplement may counteract warfarin. Alternative drug to replace warfarin. There are no alternative drug to replace warfarin. There are several drugs with the same function as warfarin, but they are not completely safe to use with St. John's wort. It is because St. John's wort affects a wide range of liver enzymes that can cause anticoagulant that are opposite of the mechanism of action of warfarin. The example of the drug to replace warfarin is epizaban, rivaroxaban, edoxaban, and dabigatran. Special precautions are monitoring advice. First, avoid concomitant use. Do not take St. John's wort with warfarin due to high risk of reduced anticoagulant. Second, frequent INR monitoring. Monitor INR level if St. John's wort cannot be avoided or recently started or stopped. 3. Patient education. Inform patient that can lead to stroke, DVT, or BF due to clotting risk. Lastly, consider alternative therapies. Use non-enzyme-inducing alternative to St. John's wort for depression. These are the 3 references that I use to make this slide. I think that's all from me. Thank you for your attention. I hope this video presentation can help more people to understand about the interaction of warfarin and St. John's wort. That's all from me. Thank you.